This is Against the Grain with Abby, the Liverpool doula.
Hi, welcome to Against the Grain with me, Abby, the Liverpool doula. Well done, and you've made it all the way to episode 3. So, today I'm going to talk about all the differences between a midwife and a doula because people say, "Oh, you're a midwife," and I'm like, no, but then it's too much to explain, and then you're like, oh, and then I've actually got a friend, excuse me, who says to her little sister, "It's the doula." And she was like, and she was like, the spiritual midwife. And she's like, "Oh, yeah, okay." And then dads will say to me, "Well, you are a midwife, really, aren't you?" And I'm like, no, 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 no. I think there's like a big myth as well, especially with midwives, that we're like some kind of failed midwife or we were only doing the job because we couldn't be a midwife. Like, honey, I went to uni, I did the whole midwifery thing for 5 minutes. It was not for me. Like, no, thank you. Keep it. I don't want it. So today I'm going to clear up the confusion and show you the value of both roles because, as you know, and as most sane people know, I don't hate midwives. I just hate the policies that they uphold. I hate the system because there are independent midwives who, some of them, I think the one who I'm familiar with has got like over 90% vaginal birth rate. Like, come on, guys. Like, it's not midwives who are the issue. It's the system that they work within that is the issue and the policies. So let's outline. Sorry, I keep yawning. I'm not even tired. So, a midwife is a clinical care provider. They do checks, measurements, assessments. They are the medical caregiver. They diagnose, they treat. A doula, however, is there for emotional, physical, and informational support, is there as an advocate, and it's just basically there as your birth bestie who has got your back. So, the differences between a doula and a midwife, and I'm just going to read you some of the things that a doula can do. So, a doula can be an unconditional ally and support system throughout your pregnancy, birth, and postpartum. They can signpost you to evidence based information to help you make informed decisions. They can provide emotional support and be a listening ear. They can help you with relaxation techniques, breathing, movement, positioning your birth pool, putting your TENS machine on. They can create a calm birth environment. They can provide soothing touch with massage or acupressure. They can provide aromatherapy. I can also use homeopathy. They can hold the space for you. They can advocate on your behalf. They can do small tasks around the house. They can support dads in their new roles as parents. And they can also support siblings as well. And they can provide continuous support and care into the postpartum period. And then I will also just read you what doulas cannot do. They cannot tell you what to do or decide. They cannot do clinical tasks such as vaginal examinations or fetal heart rate monitoring. They cannot give medical advice or diagnosis. They can't make decisions on your behalf. They don't catch the baby, although I always make a little joke where I'm like, look, if your baby was coming out and, they were going to fall on the floor or they were slipping, of course I would catch them, but we're not there to catch the baby. We're not there to give our own opinions and views, and we don't change shift or leave earlier than we have arranged. So as you can hear, we are there as just experts in support. There's no policy or rules that we follow except the ones we maybe set for ourselves and the boundaries we set for ourselves. So as you can see, there's a massive difference. We don't do the same job. The completely, although our role is to be with women, birthing and pregnant women, there's massive differences. And the main difference as well is who we work for and the rules that constrict us. Being a midwife, you have to go to university, you have to get a degree, you have to do a PIN, you have to do, once you've finished your degree, a preceptorship. I think that's what I remember it's called, for maybe a year to 2 years to prove that you are competent. You have to constantly update your training. You have to do reflections. You have to keep up with nice guidelines. There's so many things that midwives have got to maintain. By the way, like, they're hard working bitches. Like, they work their asses off. Like, not only just in uni, even once they've got the degree, like, they are working their asses off constantly. Not to mention all of the paperwork they've got to do. And the fact that they're extremely understaffed, overworked. I think that you can't have a productive workforce when you're making them work 12 and a half hours, which is how long their shifts are. So yeah, they are hard working bitches. Do not get me wrong. I do not underestimate how hard these midwives work. They work if so we're going to talk about predominantly and most commonly, and then I'll touch on independent midwifery separately. Midwives in the UK work for the NHS. The NHS governs and each trust even for each area kind of governs what their policies are. So they will be working from a set of policies that their trust sets. Now, only less than 12% of those maternity policies are backed by any evidence. They are usually governed by the insurance company who covers their insurance. So when they are caring and looking after pregnant and birthing women, they are looking at the policies and that's what they're basically working from. They unfortunately can't put individualized woman-centered care first because the policy does not dictate that. And the difference between a nurse and a midwife is that a nurse, I think this is right, obviously anyone correct me if I'm wrong, a nurse is not an autonomous practitioner, which means they answer to someone for when they're signing off meds. You know, I think the book doesn't really stop with them. Whereas a midwife is an independent practitioner in the sense that if anything happens, it's her pin that is on the line, I think. So that is why when they enforce these policies, they can hide behind the policy because if they've just done what the policy says, they'll be protected. Whereas the ones who are a little bit maverick, and they probably, if they do ever listen to this, they know who they are, they will get into trouble if anything happened, even though when they're going against policy, it's probably common sense and a lot of wisdom and experience that they know from. So that is why. So when the NHS midwife, they work for the system, as I call it, the NHS system, breathing monster machine. And they have to follow these policies and they'll have people above them breathing down the necks as well if they're not following these policies. So that's who they work for. So when they're looking after you as a pregnant woman, they're first looking at the policies, they're thinking about their jobs, and then they're thinking about you. And I've been in multiple situations where midwives have literally said, like, I've got to think about what will be said in court. I've got to think about my job. I've got to think about my pin. So that's what's going through their minds when they're looking after you. It's sad, but this is just an honest conversation. It's not judging them, by the way. Maybe it is a bit, I don't know, but it's just something that I personally could not do because I have got that strong sense of like justice and like I just couldn't do something just because something's legal and policy doesn't make it right, and I just could not do it. So when it comes to your doula works for you and only you. There is no rules around doulaing. Like Bob off the building site could literally go, I'm a doula, and be a doula the next day. We are not, what's the word? We're not regulated. Anyone can be a doula if they want to be a doula. People are doulas without even knowing that they're doulas. Like, even like when I did my training, before I did my doula training, I was in a really bad place because I was nursing my dog until the day he died. Basically, he was dying. And we'd had a group chat, and even like my doula mentor was like, I'd said, like, I'm sorry, I've not been in touch. I've been obviously caring for Angus. And she was like, because you're being a doula. Like, you're a doula if you're caregiving and supporting and, all that stuff. So that's kind of what a doula is. There's no rules about what I can do. The only thing that I think people think is that we want to be midwives and we try to impersonate midwives. It is illegal in this country, I think elsewhere, but especially here, to impersonate a midwife. We don't want to be midwives. I couldn't think of anything worse. I couldn't even bear the paperwork. It's ridiculous how much paperwork has to be done now. So we work for the families that employ us, and regardless of obviously other doulas support hospital births, I do not. But if you want to give birth in a hospital or in the forest, your doula, it will literally be like, yeah, sounds, whatever you want to do. We don't work for anyone except you guys. And that's why we are so valuable, because our only real concern is that you're happy and that you feel supported. And we're not thinking, oh God, are we going to get into trouble? Because we don't really answer to anyone except ourselves. It's probably an issue with that. I think a lot of doctors, especially in midwives, but I think the obstetric community don't like doulas and they think we should be regulated. But at the end of the day, a doula is not making any decisions. They're not advising. So I think it came out that there was like, I think they tried to scaremonger in the news saying, of this many baby deaths, 9 of the births had doulas present. I think it was like, I was like thousands of births, and, it's like, shut up. Like, where was the birth? It was in hospital. Like, it's not the doula's fault. So I think that they just hate that we're there because we obviously promote informed consent. So obviously, I've just touched on the training for a midwife. Obviously, if you've got your GCSEs, or you can do an access course, you go to university for 3 years, then, do another year or two working on the wards as your preceptorship, and then you're constantly updating your training. So for being a doula, a lot of doulas, you don't have to either. Like, there's no rules around it, but a lot of doulas will do a certified or accredited doula training course. I did one with conscious birthing with Kate Woods. I went and lived in Glastonbury for a week. It was fantastic. It really just cemented everything I knew, because I've always been like a science evidence girl, but also like common sense, and it just backed up everything I knew. But I do think the fact that I've got that tiny little bit of midwifery experience really like cemented my confidence in entering the birth space, especially in the beginning, because I'd caught babies, I'd been there, and I kind of knew what it looked like. Whereas I can't even imagine going into a birth as a doula, a baby doula, even like, so they'll say like you get mentored when you're a baby doula, and I think you keep your mentor for like three. I think I kept mine for like 4 or 5 births, just because I really like love their support. And you still go into births alone. You just debrief with them and you let them know how you get on, and the mentor will ask the client for feedback, but you're still going in alone. Like, you're fully alone. It's not like you're not shadowing someone. So you're going in as a doula, like, but at the end of the day, you're not responsible for the outcome of that birth. You're not responsible if something bad happens, because you will have outlined all of that with your client. You're there to just support them in anything they want. So they're kind of the rules. So doulas, there are no rules, but we're not responsible for it. You know, there's probably doulas out there giving bad advice, but there's midwives out there giving bad advice. I think understanding that we're not there to give our opinion or advise you, we can lay out evidence, which I think a lot of medical professionals get confused with. We just lay out evidence and women can make their own choice. And that's another issue with the system, is that just because we're laying out the evidence, these women, like, I think they think we're coercing them into things. Like, we just give them the evidence, that is up to them what they do with it. And sometimes if they even don't want evidence and they just decline things, that's okay too. So yeah, another big question that people ask me, do midwives hate you? Yes, some absolutely do. Some really, really show it. It's so obvious. Some hide it really well. And then some really like me. The ones who I think really like me could hate me. I'll never know. And you know what? It's none of my business. I work well. We've had one issue in a hospital with one who was wild in the things she was reporting about me. But you know what, again, like, it's not really my business what people say behind my back. And yeah, I've worked with midwives, multiple midwives, most recently in the hospital, and we didn't butt heads at all. However, I just kind of questioned a few things, and the client was fully strong in her decisions, and I just helped give her more time to make decisions and pointed out a few things. But at the end, the midwife actually apologised and was like, I'm sorry, I was pushy. It's just the policy and it's drummed into us. And you know what? Fair enough. That's absolutely fair enough. And I think they can see both sides, but they're just so fear driven and told this could happen. And then these strict guidelines that they're given around how long things should go on for, they're not backed by evidence. It's just a policy. But because the policy is so ingrained and that's all they've learned, they just think, oh my God, this is so unsafe. And they think like bad things are going to happen, when actually birth is not linear. It does not, you don't contract, you don't dilate 1 centimeter every hour, and pushing is not for this long, and contractions have to be exactly spaced out. Like, it's not like that. It's so different. So I also can include some personal examples of where I've worked with midwives. And there's been times where, obviously, briefly, because I'm usually the one who rings the midwife if I'm at a home birth, and I let them know. And there's times where midwives have been like, where I've said, look, I think this needs to happen, this is between me and the midwife, like, this needs to happen or that needs to happen. And they're like, yeah, yeah, I agree. And then there's been times where I've rang them and they've said, well, she needs to get out the pool and I need to do obs. And I've been like, whoa, she's actually declining them, and they think I'm the problem. And I'm like, Lovey, have you got such little respect and care for grown-ass women that you think that a woman can coerce and convince her to do something? Like, come on. So yeah, and a lot of midwives, they're more curious about the job. And I think some of them, and I know that people, they're going to go, no, we don't. Some of them could be a little bit envious of like the level of freedom that I can what's the word? The level of freedom that I can kind of express and go to and pick. I pick my clients. I don't have to do any paperwork. Nothing comes back on me. It's not my responsibility. It's actually like a really lovely job, apart from like sometimes long hours, but that's really the only downside. And probably being, oh, excuse me, probably being spoken to like shit by medical staff. However, when I'm in birth mode, I don't even notice it. Like, if I had to go into the maternity hospital alone, I would be a little bit anxious. But when I'm with a client, like I'm just on, like I'm in the zone mentally. I'm there to do a job, and I don't give a fuck. Like my client is getting treated well. They're going to be respected. So yeah, the reason why both can be essential for a positive birth, especially if you are engaging with, NHS or just your regular midwives. Unfortunately, your midwife is so overworked, they're so understaffed that sometimes they can't even stay in the room with you. So if you've got maybe a partner who is struggling with supporting you, if they're tired, if they're overwhelmed, having a doula there can literally make or break the experience, because you've basically got someone there as a servant. And I don't mean servant in a disrespectful, like derogatory way. I literally mean like when I am in a hospital or a home birth, like I am there to serve that woman in any way she needs me. And imagine having just like a babe there who's just there for your well-being. Like it must be gorgeous. Like someone who's there to literally like feed you, make sure you've had a drink, massage you, make sure you're warm, you're too hot, you're too cold. Like they're there to serve you like a butler. I don't know, like sounds like ridiculous, but that's how I think. I'm just like, girl, what do you need from me? And I am here to just cater to your every whim. And that's how I serve my women. And I think people just don't even see this, because I've got this persona on Instagram of people who don't know me and they just see the Liverpool doula, and they don't see like the very soft serving side of me. So yeah, that's what your doula is there for. And your doula can basically, because as well, I think a lot of women think that because they've got a birth plan that their birth's going to be respected. Like I'm there to make sure your birth plan is respected. Like don't even know. I'll be like, as per the birth plan, as per her birth plan. I think they think that I'm just being funny. I'm like, no, this woman has made this birth plan and we are going to respect it. And not to blow my own trumpet, but I do think a lot of the times it would have descended into absolute chaos if I'd not been there. Like, this is where I can walk away with my head held high and be like, wow, that was hard going, but they got the birth they wanted. And I played a small part in that. And it's a really, really like, excuse me, it's a lovely feeling knowing like you've gone to work and made a difference. And you know what? The main reason why I do this job, obviously, I want women to have beautiful births, but I want these babies to have beautiful births. So I'm just going to bring up a few red and green flags when choosing your birth team. So, and here's where I'm not saying all doulas are created equally, and there's probably bad doulas out there, the way there are bad and good midwives. So, red flags for your doula. I don't know if I'm going to get some heat for this. I wouldn't go for a doula who takes on any kinds of birth. I would want someone who is, I don't know, am I saying this? Because no, I take that back. I take it back, because I feel like they probably, if they take on any kind of birth, this is me thinking out loud now, processing. If they take any kind of birth, they've experienced every single range. So I absolutely take that back now. No, that's wrong. I think a red flag in a doula is maybe, I don't know, maybe I'm a red flag. She'll only take on home birth or free birth. There's a red flag. I don't know. But I think a red flag in a doula is someone who maybe is quite like not soft, because soft is nice, but you want someone who's quite mentally strong. You want them to be able to advocate for you. They're not going to be scared to stick up for you. You can like you want to know if you do like if you're going to birth in the woods with your dog cutting the cord without midwives, you want to know that they support you. You also want a doula who believes in birth so much. You want someone who doesn't seem flaky, because when you need them to be with you, you need them to be there. And I'd say if you don't connect with that doula, do not hire them. Like, don't hire them. If you're not feeling that vibe, and this is the thing, people think people will just interview me. No, like if I don't like you, I will not hire. I will not be your doula. We've got to vibe. We've got to connect, and most importantly, I feel like your beliefs have got to align. Like a lot of the women that I work with have got the same belief system as me, because if I watched certain things going on with your baby, which I'm not going to say, I just couldn't watch that. Or if you were not nourishing yourself in the way that I think you should be, I just couldn't be down with that. And maybe that's just because I'm a very blunt, to the point person. And it's not that I don't respect other people's lifestyles, but it's just, I don't know. I just feel like you've got to have some kind of morals and that same ethos. And yeah, I don't know. That's just my own belief system. Not to say that if someone was truly vibing with me, I'd be like, girl, obviously, I think some of them are meant to be, and they're meant to be your doula. And yeah, I'd say some red flags with midwives. If they completely quote policy constantly, I always say to clients, like, you should just ask your midwife about free birth. Free birth, if anyone doesn't know, is birthing without a medical professional present. And if they react wildly, shock, horror, tell you it's illegal, that's a red flag, because it's not illegal. And it shows that they don't understand that free birth is a legal right.
Another red flag is for them never asking for consent. So you've got to be very careful about this language. I think it just comes naturally to them. Like they'll say, hop up on the bed, pop your top up. I'm going to just have a feel of your belly, or I'm just going to listen into baby, or I'm going to take some blood. And nothing's ever explained. The language should actually be, can you hop up on the table? Would you lift your top? Because, excuse me, I would like to palpate your stomach, and what I'm feeling for is XYZ. And then, is that okay with you? Or would it be okay for me to listen into your baby? Or would it be okay for me to take some blood because we're going to run these tests and they should explain the tests XYZ? And because a lot of people don't know, they just take the blood and then they just run these tests, including like STIs and stuff, which, you know, if you want it, great, but they don't actually tell you what they're taking your blood for and what they're testing it for. Another red flag would be saying, oh, you're not allowed, or the consultant won't allow that, or you can't, or we always, or you're not allowed to. That is another red flag. So this is why it's so important to be aware. And I feel like when I teach women this, they, once you see it, you can't unsee it. And they're so aware of it because it's just ingrained into like modern medicine of the patient or the woman. Obviously, I'll just say patient for argument's sake. In hospitals, is just like the submissive, you know, passive person who has things done to them, you know, and doctors will think you should do XYZ, and you know, you're just passive and you have things done to you because it's kind of like we know best kind of attitude, when actually any patient, regardless of its maternity, cancer, heart disease, I don't know, surgery, whatever, should be an active participant in their own care, especially women, because pregnancy is not an illness. So that is a massive red flag. So these are some of the stats around having a doula. So having a doula, there's a 39% decrease in the likelihood of C-section with continuous doula support, which is the support I give, a 15% increase in the likelihood of spontaneous vaginal birth, a 10% reduction in the use of pain medication, a 31% decrease in the use of induction drugs, shorter labours by 41 minutes on average, and a reduced risk of birth trauma and dissatisfaction. So it's literally hiring one woman, no machines, no drugs, just literal presence, and she can dismantle their whole multi-million-pound protocol, and no wonder they will not let us in. The reason why hospitals exclude us is because we are not trained to obey, we are trained to support. We remind women that they have options, which obviously delays procedures and cuts the profits and slows down the conveyor belt that they usually have going on. And we will say to you, like, you can say no, whereas staff will say, no, this is policy, like, and they kind of don't give you an option. And we kind of hold the line when coercion creeps in. A lot of midwives will say doulas interfere. Damn fucking right we do. We interfere with unnecessary surgery, necessary trauma, unnecessary interventions, and we kind of put a stopper in when hospital policy is overruling individualized care. Hospitals would obviously rather have compliant, obedient women who just say yes to whatever. And obviously, a doula's presence reduces the fear and increases oxytocin, which makes the which is the hormone that makes birth work better. And obviously, the system profits when oxytocin fails and adrenaline takes over. So if you've got a stalled labour, you're going to need more intervention. And in places where doula programs have been introduced system-wide, parts of the US with Medicaid coverage with doula support, there are lower preterm births, there are lower maternal mortality rates, improved breastfeeding rates, and higher maternal satisfaction. So doulas aren't just for hippie births. Black and Indigenous women in the US who work with doulas experience a more than 50% drop in adverse birth outcomes, and that's because they're protected from systemic racism and neglect which runs deep in our maternity systems, and that's exactly the same in the UK as well. Women of colour and black women have worse outcomes in the NHS. So doulas are here to basically be the buffer between. So yeah, that is everything to do with doulas versus midwives. So I hope this helps clear things up. Share this with someone who doesn't quite get what a doula does. If you have got a birth partner or a dad who is unsure about doula care and doula support, please send them this podcast. If you are interested in my doula services, you can book a free 30-minute chat. If you go to my Instagram, the Liverpool Doula, you can click the link and you can book a chat, see if we vibe. I also offer virtual doula care for pregnancy and birth, which can be undertaken anywhere in the world. You've got access to me and I can be on call virtually for your birth. So you can find me at the Liverpool Doula on Instagram or www.theliverpooldoula.co.uk. Thank you for listening to Against the Grain with the Liverpool Doula, where we question everything and reclaim our power. Nothing in this podcast can be construed as professional advice. It does not replace the guidance of a trained professional. These conversations are here to spark curiosity and offer perspectives, not prescriptions.